Thank you, Joel, for joining me today. Can you tell me more about yourself, please?
Yeah, Joel Smith. I'm the Health Services Administrator here at Bayview in Seattle, Washington. I've been a skilled nursing administrator for 25 years now, and all in the state of Washington. So I've got quite a bit of experience with skilled nursing and the regulatory environment here in Washington. Bayview is a CCRC, or a life plan community. We have 5 different levels of care here. There's independent living, there's assisted living, the assisted living memory care, the skilled nursing facility, and then of course our child development center. So one of 2 facilities in the Seattle area that offer child development, and it adds a different element, as you can imagine, to have children along with the geriatric population. Bayview, lastly, is a life plan community of 62 years and above. So all of our residents are more than 62 years of age.
Approximately how many staff or colleagues do you work with?
Yeah, I guess I should talk about the skilled nursing center in specifics. The skilled nursing center is a 50-bed facility. It's licensed for 50 beds. We can have about 48 people in there. 2 of the beds were converted into private rooms. And so our average census is about, we're budgeted for 38 and a half, and our average census is about 38. So little room to grow. As a life plan community, we have to keep a certain number of beds open just in case some of our independent or assisted living people have an acute crisis. Then they can come after their hospital stay, can come to the skilled nursing center. For the staff, we have approximately 80 staff members for the skilled nursing center. And I want to say probably 60 of those are various forms of certified nursing assistants, whether it's on-call, part-time, or full-time. With the staffing issues of today, we try to take as many as we can and fit them into our schedule as much as we can. And then about 20 nurses, and again, with all various different types of on-call status, full-time, part-time status as well.
And do you have staff that cross over between the various settings from your CCRC?
Yeah, that's a great question. Sometimes we do. For the most part, we don't. It's my goal to want more cross training, but generally, if somebody enjoys assisted living, they want to stay in assisted living, and if somebody enjoys the skilled nursing environment, then they stay there. There's pros and cons to both concepts. The biggest thing that we find as a pro right now is that we try to keep people in their sets so that they can learn the residents the best and get to know the residents' nuances and really kind of perfect that individualized care.
Thank you so much for describing your center.
Mhm.
You agreed to join me today, and I thank you for that, to talk a little bit about what you've been doing as a participant in our Driving Clinical Excellence in Unstable Times Learning Collaborative series. And I'm really interested to hear you describe a procedure or system that you've recently implemented to improve your patient safety or infection prevention and control programs.
Yeah, one of the things that struck me during the meetings is the concept of QAPI in general, and having it be more flexible and more targeted, if you will, in that fashion, because in general, I looked at QAPI as a big, huge, overreaching program that took 2 hours a month, that you had to prepare for a whole week, and you put together this whole packet of information, and it took forever to go through all of those pieces of the processes and the systems and the things that you're working on to improve. What really struck me through Comagine was the concept of taking these big overreaching programs and making them digestible, if you will, on a daily basis for a 15-minute meeting or a 15-minute injection into the daily fabric of what we do. And so I took this 15-minute concept and I created into what I call it's a pulse check or a QIN-QIO corner. I kind of coined it the QIN-QIO corner. And so what I do is, as an administrator, I come in super early in the morning and I usually leave late in the afternoon. So in the morning time, I can meet with the night shift, the off-going shift of night shift, and I can talk to them about certain concepts just as a small group. And then as the day shift comes in, I prepare them for the day. Again, a 5-minute to 7-minute session on things that I think that we should be able to focus on. And these focus topics are generated from our QIN-QIO meeting. And so, giving the aides the direction of the day and talking to them about certain things, the concepts of why we should be doing these things, it really helps them kind of stay focused for the day, and it gives them that little extra boost. And then, of course, the evening shift comes in later on in the afternoon. And so as the off-going or the day shift is off-going, the evening shift comes on, and I do the exact same thing with them. Just have a little QIN-QIO corner or a pulse check, and we sit down and talk about the concepts for the day, the programs or the processes for the day of what I want them to focus on. I call it the pulse check as well, because, if you can imagine, I try to at least 3 times a week be able to do this, but my goal is 5 times a week, Monday through Friday. I want to be able to sit with each shift and talk to them about these concepts. But if you can imagine, by Wednesday, so you're talking about, let's say, oral care. And so on Monday, you talk about oral care and the reason why it's so important. And then on Tuesday, you go and talk to them about oral care and the reason why it's so important. And then by Wednesday, they say, yeah, I get it, oral care, right? And so they kind of understand what concept of the week is that you're working on. And so then at that point, I kind of turn it into a pulse check where I say, great, I know it's excellent that you guys have the concept of oral care, but talk to me about maybe some of the barriers that you've had with oral care. And we really kind of turn it into that pulse check and their feedback of what's going on, which can drive the QIN-QIO process. And so from there, I ask them, well, what is your solution to these things and what kind of things need to happen? And sometimes it's a care plan change. Sometimes it's notifications to family. Sometimes it's just neat little tricks that the aides pick up as far as how to get better oral care being conducted. Sometimes the aides will say, oh, well, since I was helping this person, they're now more proactive and they're actually asking me about oral care and things like that. So you can kind of see their excitement and the improvement that happens just in, let's say, that process. That's something that we've experienced. So, and then the following week, we change the process, we change the program. Again, I don't want to throw a bunch of stuff at them, having several different processes all at once, because then it kind of becomes overwhelming. I always make sure that during the QIN-QIO corner and the pulse checks, I tell them that this is a QIN-QIO meeting so that they know that they're part of the QIN-QIO process, and that their say, what they are doing is meaningful, and that when they have feedback, that it's being listened to and it's being incorporated into what we do into QIN-QIO. So that's always important too. So it's actually worked out really, really well. It's a really cool process. So
That's amazing. Just listening to you speak, I can hear the concepts that you've put into place, that participative management, where you have them engaged in giving you feedback and suggestions on something that they're trying to improve. You're also helping them to connect meaning and purpose to their work, which helps to improve joy in work and hopefully staff retention, which I believe you said you're trying to measure that to see if
right.
there's an impact. Can you
Yeah.
tell me a little bit about the staff's response to this change that you've implemented, and any feedback that you've gotten from them about this intervention that you're doing?
Yeah, I think at first, they were pretty skeptical. I mean, oh, here's the administrator coming in talking about, X, Y, or Z. But as they saw the program kind of evolve over probably a 2-week period of time, that's when they really started to become engaged, because they knew that it was something that wasn't necessarily going to just fade away. And they knew that we were committed. And they also started to see that I was engaged with them, and that I was listening to them, and that what they had to say was important. So yeah, it started off a little bumpy, as always. Change is never easy, but as you continue on and as we continue through the program, the engagement is pretty good. It's really great.
Are there any mechanisms that you have in place that support you in determining whether or not this is working?
Yeah, the big question is, well, how do we determine what programs it is that we want to focus on for the month? And each week we have a different program or process. So at our big QAPI meeting, the big 2-hour-long meeting that is very involved and detailed, we really talk about, each department head talks about the issues that they feel are important, the 4 issues. We bring 4 issues to the forefront of what we feel that we could highlight throughout the month, throughout the following month for QAPI, for the QAPI corner or the pulse check. And so those concepts are brought forward. We make sure that we detail it in our QAPI notes as far as, week 1, week 2, week 3, and 4. And then the department heads, especially the ones that it's more meaningful for, they have more skin in the game where they're going to be more involved with it as well. So it's not just me going out and talking in small groups. It might be the director of nursing also that helps spot throughout the day. And then it might be the resident care manager or the infection control steward that, throughout the day will do little spot checks. And some of the engagement that we've seen from the staff is that they don't just come to me, but they also go to those other program managers and tell them that they've done something good. And so we're able to give them little kudos, and sometimes we give little candies, or sometimes we might give a small gift card or something like that, just for a job well done, and for their involvement and engagement. All of these things that we try to do, that we try to highlight, are usually measured in some form or tracked in some form during QAPI. So for instance, with falls, of course, we have a fall tracking mechanism that we use, and sometimes we highlight, we'll look at the falls per 1,000 resident, falls per 1,000 patient days per resident, tracking to see if that number decreases. And then we also look at different shifts, so for day shift, evening shift, or night shift. Sometimes we may focus falls on a particular shift, and we'll see that those falls may decrease, but then all of a sudden the falls may increase in a different area. So it's hard to kind of keep on top of, and some are hard to actually track. So for instance, like the oral care, it's hard to really track those things as far as if everybody is getting good oral care. But there are audits and spot checks that we do, that directors do and resident care managers do, to make sure that everybody has minty fresh breath. And also we get feedback through things like our employees, our resident satisfaction surveys, or our family satisfaction surveys. Care conferences are also another good place for feedback for certain programs like the oral care program. So yeah, we definitely, part of QAPI is making sure that you track that data and you see if there are improvements. That's part of the performance improvement program. So we want to make sure that we're continually moving forward and seeing efforts in those. And if we're not, then we'll, just like normal with the PDSA, we'll make small changes, and then we'll try to re-implement those changes. Or we may bring ideas to the QAPI corner, where we'll talk to the aides saying, well, this didn't necessarily work, so let's give it a try to do this or to do that. They're more receptive to trying to do things now, knowing that this is a program that is that we're doing on a weekly basis, or a daily basis, basically. Yeah.
That's wonderful. It sounds like you're actually teaching them about real-time measurements and improvement that's associated with this. So you're building their capacity to participate in QAPI as you're going through this.
Definitely. One of the things that we are starting to do is starting to post in the employee lounge and on certain department doors, the tracking of certain things. So for instance, the falls and our fall report, it's not it's not a secret. It's something that that everybody should know. And so we post those in the employee lounge so that people can look. We haven't quite got to the competition level yet where, day shift is competing with evening shift for the number of less falls. But I imagine that might be coming relatively soon. So just to keep that engagement moving.
That's awesome. Can you share a little bit about any barriers that you may have encountered with engaging your staff?
In every group, there's always, a naysayer here or there. And so, it's trying to work with those people to understand what their barriers might be. Sometimes it's just an employee that is not the best employee. And so you have to work through some of those other issues to get the employee to be more engaged in the actual care of the residents. But I think that the biggest thing is making sure that that it's consistent and that you're present, during those meetings and during those times, and that you're not just preaching to them, well, here's what we're going to do today and blah, blah, blah. That if there is any feedback, that you take the time and listen. I say it's a 5 to 7 minute deal because what I like to do is after the 5 to 7 minutes of talking with the staff is I want to document down what was discussed so that I can make those into QIN-QIO notes and things like that. But sometimes it takes a little bit more than 15 minutes. Sometimes there are real issues that the aides want to talk about or that the nurses want to talk about. And so you've got to be able to take the time to listen and to write those things down. Sometimes they are, sometimes they pertain to what we're trying to do with QIN-QIO, and sometimes they're completely different. But having that presence and that engagement, I think, helps the staff know that you really care and that you're there to support them and that you're there to be there for them, so they don't feel alone. Yeah.
Are there any systems or procedures that you've implemented as part of this process that to improve your patient safety or infection prevention and control that didn't work as you anticipated they would?
Yeah. Well, not necessarily from an infection control standpoint, but from a resident engagement standpoint, we really, how the whole 15 minutes check started was not just from Comagine. That was a big piece of it. But we had also, before we attended these meetings, we had started a small morning fitness program where we had our wellness director come into the health center or into skilled nursing, and for 15 minutes, we would do stretching exercises and little exercises to kind of loosen the body and free the mind and free the spirit of the day's tasks, and just take that 15 minutes to really kind of stretch and be a cohesive group and to really kind of get ready for the day. It was a really fun exercise, and the staff really enjoyed that for probably about 3 months, maybe 4 months, 3.5 to 4 months, and then after that, the fitness started waning. The wellness fitness coordinator took some vacation and took some time off, and so there were a couple of days or so that that weren't part of the fitness. And for the first days or so, a lot of the staff were like, "Well, where's the fitness? Where's the fitness?" And then it became more inconsistent. And then other people were like, "Well, I don't have time for this. I've got to make sure that I get so and so up for breakfast," and things like that. And so the engagement really dropped off rather rapidly. And you could tell that there was a different feeling on the floor. And so in order to get that feeling back, that's where the 15-minute QIN-QIO corner and the pulse checks really kind of flourished and came into light. It was like, well, we used to set aside a time to do this. So now let's do this again, and let's take it to the next level, because it's not just for day shift, but this should be for night shift and for evening shift. Night shift always feels like they're left out, and so to be able to go early in the morning and take the 15 minutes to really talk to the night shift about these processes makes them especially feel even more important. So that's kind of where this started, how we kind of had a little hiccup or a failure, and then we were able to get it back in place. And my hopes are that um, uh, each month you've got different topics, and some of the topics might be the same, but some of them will change. And so it keeps it fresh and it keeps it new, if you will, so that there's not, so that residents don't get bored with it, right? I have to admit, the one area that I'm lacking in right now, and I'm struggling to figure this out, and with the help from Comagine and with the help from my team, are the weekends. Is because we don't have 7-day-a-week RCM coverage, or we don't have a weekend manager at this point. So the weekends are really where there isn't much discussion about. In fact, there's no discussion on the quality assurance and performance improvement. So that's an area that I've got to shore up. But right now, I'm proud of the 5 days that we're doing, and I'm proud of the work that we're accomplishing so far. So.
Thank you for sharing that part. That kind of leads me to this question that I'd love to hear more about, is your staff morale. How would you describe your staff morale? And are there differences between, as you're saying, days and evenings, nights, but most specifically weekends and weekdays? Because are they hearing things about what's going on and feeling left out? Or, if you could elaborate a little bit, I'd love to hear about your staff morale.
Yeah, I truly believe that the staff morale is better. It's funny. There are some times where it kind of ebbs and flows a little bit. Sometimes the staff morale can be really good, and then other times it can be bad. And sometimes it deals with some of the processes that we're dealing with. So, for instance, the showers. The showers are a big deal. Because we've got to give our residents, we've got to get our residents clean and give them showers. But not everybody likes showers in the day, and sometimes they like showers in the evening. So we kind of, through our scheduling, we had issues where our shower aide, we had a designated shower aide, and that person ended up leaving and going to a different job. They actually got a job in a hospital. And so I ended up splitting up the day and evening shift. Our budget allowed for it allows for basically 12 staff, 12 CNAs a day. And so I before would split it up 6, 4, and 2, 6 during the day, 1 being a shower aide, and then 4 in the evening and 2 at night. And so when the shower aide left, what I did was I hired another person for the evening shift, because you always hear about the evening shift saying that they don't have enough help. So I thought, okay, well, what we're going to do is we're going to split up. We're going to go 5, 5, and 2, and we're going to have each shift do the showers. Because again, not everybody likes showers in the day, and not everybody wants showers in the night. It ended up turning into be a real problem, which affected the evening shift morale, because day shift would pick the people that they would want to shower, and then evening shift felt like, oh, well, day shift's just giving us the people that they don't want to shower, which was not necessarily the case. So we've since then, through our coffee corners, we've explained this process, and we've talked to them about what their solutions would be to this, and what it really came down to, of course, was resident preference. We need to know on the shower schedule that the resident preference in a different color is for day shift and a different color is for evening shift, so that when the evening shift people see somebody who actually has a preference for an evening shift shower, they realize that it's not just day shift that's trying to, give them a hard time. That's where the morale kind of ebbs and flows. And so now, of course, the evening shift morale is a little bit better, because they not only have an extra staff person, but now they realize that the showers are designated for them are because of the residents and not because of the staff. The day shift morale is a little, they're kind of wavering a little bit, because they feel like, well, you took my person away. We used to have 6 and now we have 5. And so it's one of those things that we're trying to work with. And so we're being a little extra little extra friendly to the day shift people. I think one of the measures, though, is that we can see that the number of call-offs have decreased, which is great. So that's one measure that we're using to look at that, because we used to have a pretty bad call-off rate. So typically it would be anywhere from 45 to 50 call-offs in a month, which was just a lot for a 50-bed facility. So the number of call-offs have dropped off about in half. We're about 20 to 25 right now for call-offs, which is still a lot, but it's certainly a lot better. So that's working, which tells me that staff stabilization is helping, and our retention is getting a little bit better. So eventually we're going to be able to hire more people in and get rid of some of the agency that we have going on and things like that. So it just takes time.
Yes, it does all take time.
Right.
Well, you mentioned agency, and we didn't speak about that very much at all until this moment, but are they included in your QAPI corners or your pulse checks?
Absolutely. Yeah, they definitely are part of the whole process. They need to understand that even though they're agency, there are quality initiatives that are in place that I expect them to carry through just as a full-time person. So it's easy for them to be able to implement these things. These things aren't hard that we're trying to implement. It's, for instance, using the oral care, it's brushing somebody's teeth, which is part of their job. But if they don't know that that's a focus, then they may not focus on that. It could be falls. And so, if they don't know the particular residents that are frequent fallers, then they may not know to pay extra attention to them. So it's one of those things that these are the things that we discuss in these meetings. And so they're definitely engaged as well. I think that it also makes those agency people want to work for us more, because they see that that we've got a good system in place to be able to get staff engagement and to get their feedback as well. So not like I want them that much more. Maybe if they want to join us full time, that would be great. But maybe we'll see how this works out in the future. So,
Wow. This is amazing to hear you speak about some of these things. And I can hear the elements from that high reliable framework that we've been talking about for our collaborative. To hear you talk about excuse me, becoming a continuous learning organization, and how you're building reliability in processes because you're sharing with the staff what is expected and how they should be performing their tasks, being transparent about the results that you're seeing, and then holding people accountable too, so that as you're sharing this, you're actually elevating the level that everybody's expected to perform at and giving them the support to do that.
right. Yeah, definitely. And I think, having several different factors that you focus on each week and each month, I, it, you know, the old saying, the old adage is once you focus on something, things improve. But then as soon as you turn your attention to something different, the things that you were focusing on tend to drop off. And so these things, because we bounce each week from different topics, they tend to, over a month's time frame, they tend to stay relevant, and they keep that performance level up and the accountability up. Yeah.
That's awesome, Joel. Well, tell me, how are you involving the patient, the residents, and their family members in this process or this intervention that you've implemented?
Yeah, just as we said, we're making sure that we are doing patient interviews or resident interviews, making sure that we understand what their preferences are. We involve them in care conferences, and we elicit their feedback for certain programs and processes that we're focusing on. Same thing with the families. A really easy one to talk about is the fall initiative, and as far as involving families. Sometimes when you have a resident that is a frequent faller, we'll directly ask the family, can you come in a little bit more often, and stay for a certain amount of time so that you can help us keep the resident off the floor. If the resident starts to get agitated or wants to get up out of bed, you can use the call light and help communicate those needs and help us understand what those needs are. And we can track those needs and figure out when the needs are higher and when the needs are less. Sometimes we even ask the families to, if they can't be more involved, to assist us with a one-to-one provider, whether it's through a home care service or a private caregiving service. And a lot of times they will come through for small sections during the day or during the night to be able to pay for those things so that we can have that extra support. You know, with only 2 aides and 1 nurse on the floor at night with 38 to 40 patients or residents, it's hard for those 2 people to really focus on 3 or 4 different frequent fallers. And so having that family support helps. And that usually all comes out through the care conferences and things like that. It also may come through therapy sessions. The therapist may talk to the family about those needs or issues. Same thing, the therapy sessions with the residents are involved. Obviously, as you're getting that therapy treatment, the therapist will talk about strategies to help improve certain things. So, you know, we really can't do any of these initiatives without our residents, right? So you've got to make sure that you involve them so that they understand what your goals are, because our goals need to align with their goals. And I'm sure that the goals that we have, like good oral care or fall initiatives, you know, staying off the floor, those are all the same goals that the patients have or the residents have. So we have to be communicating that so that they know what we're doing.
Do you do any like official kind of formal education about quality improvement for your residents and their family members?
You know, we talk about it on admission, and this is probably, as I'm just thinking about it, Donna, you know, it's probably something that we could do a little bit better of a job on. I know that I've been working with activities on formalizing our resident council process a little bit more. Our residents love to have a really loose resident council, but I think that having a small coffee corner for them, as well as having a resident right of the month and, you know, and a guest speaker of the month. Those are things that I'm trying to implement as well. And so I think that now that we're talking about it, we could have a small coffee corner in the resident council meeting as well, so that we can get the residents engaged too. Yeah.
Oh, I look forward to hearing more about that.
That's a new one. That's going to be new. So
That's awesome, Joel. I love how you're always thinking so creatively about how to really move things forward, that you're always looking to improve your organization. And I love hearing the stories about how you've done that.
thank you.
One last question. If the interventions that we've been discussing were to be shared with a team like yours, what's the best piece of advice or best practice that you would tell them would drive success?
Yeah. The best piece of advice I could give is consistency. You've got to you have to commit to this, and you have to be consistent. If you waver at all, the staff will realize that this is not a serious program, and that you don't take these things seriously. So you have to have the time to be able to commit to it. And sometimes that means staying later at night, you know, to work on other stuff so that you can focus on these initiatives during the day. But you know, it's after 25 years of being an administrator, it's just the nature of the beast. You know, I mean, you've got to really remain committed to this, and stay focused, and make sure that you're consistent. That's the biggest piece of advice. The aides love the consistency. They love having the administrator or having the director of nursing come to them and ask them for their feedback and talk to them about what's important. It gives them value to their job every day. And it makes them feel like when they've been as simple as something as oral care, when they've been able to accomplish that for all of their set and all of their residents in their day, it makes them feel like they've gone home and they've done something good for the day, which everybody wants to do. So, you know, and believe me, sometimes there are days where you go home and you don't know what it was that you accomplished during the day. But for the frontline workers, it's so important to give them that win for the day. And the consistency is really what matters, because again, if you're not consistent, it's just another thing that has gone by the wayside and fades away. So consistency, that's where it's at.
Oh, thank you so much, Joel. I really appreciate those words of wisdom.
Thank you.
I am very grateful that you've taken your time today to agree to teach us what Bayview Retirement Community has been doing since July, I believe, is when you started
Right.
this initiative, and just outlining for us some of the key elements that you've taken time to incorporate into your day to help your staff to be successful and your organization to just thrive.
Thank you.